Tumors among the deadliest of all cancers, and treatment including surgery, chemo, and radiation can be grueling and not very effective.
Now CBS 2's Dr. Max Gomez tells us about a promising experimental treatment for brain tumors that uses electricity.
That's right, Ouija and Dick. You know, electromagnetic fields is really what we're talking about here. We know that magnetic fields can affect cells in the body. That's how MRIs work. And depending on the strength and frequency of those electromagnetic fields, they can stimulate healing, cook food in a microwave, or in this case, kill tumor cells. Doug Lawrence wears a special cap to fight terminal brain cancer, and it seems to be working. His wife says initially he was given only 6 to 18 months to live.
We thought, well, maybe Doug wouldn't be here for this holiday, but here he is. And just knowing that we're all still together, that's a blessing too.
I'm still alive, so I don't know how else I would say that. The thing is that I should have been not here.
Doug was diagnosed with glioblastoma nearly 2 years ago. That's when he was starting an experimental treatment at the USC Norris Cancer Center in Los Angeles. The 71-year-old wears the NovoCure cap around the clock. It sends painless electric signals to the brain to stop cancer cells from dividing.
If the cells aren't dividing, then the tumor's not growing.
And since in the normal brain cells rarely divide, brain cells are unharmed while the dividing cancer cells die off. Lawrence has an MRI every 2 months to make sure his cancer isn't spreading. So far, no change. Doug is trying to make the most of every day and savoring his time with his family.
Well, I got some grandkids that need to be chased around the house and around the Christmas tree, and it's a family deal. That our family's always been a good, solid family. Gonna stay there.
And you're gonna be there for it.
Absolutely. Will not stop.
Now, the JFK Medical Center in Edison, New Jersey is also one of the clinical trial sites for the NovoCure cap. The cap is already FDA approved for recurrent brain cancer. These tests are to use it on newly diagnosed brain tumors. It's not a cure, but it extends life with no real side effects. Dick, Ouija?